Welcome, everyone. I'm Andrew Schulman, the Vice President of Marketing at Populus, and I'm thrilled to be hosting part one of our new webinar series, Virtual Care in America, the Populus Report. Thank you all for being here. Today, we're taking on the patient perspective and unpacking some of the key insights garnered from our report with our expert panelists. Earlier this year, Populus, along with our partners DHC Group, PM360, and ResearchScape, fielded and triangulated a national survey to over 1,250 virtual care users, patients on one side, healthcare providers on the other, and pharma marketers in the middle. All asked about the same thing: how virtual care is functioning inside American healthcare today. Let me introduce the people who are going to break it all down for us today. Christine Franklin is the Executive Director at DHC Group and leads the HCP survey side of the equation. She'll bring those insights and her expertise into play for us.
Hi, Andrew.
Hi,
How you
welcome.
doing? Thank you so much. I'm happy to be here.
Me too, and to have you here is a joy.
Thank you.
Ray Rotolo is Populus's Chief Experience Officer and co-founder, and was close to this report from the beginning. Ray's deep experience in the space offers us our category point of view expertise.
Thank you, Andrew. Pleasure to be here with everyone.
All right.
And Taylor Wexler joins us from Havas, where she is the Director of Investments for Point of Care. She is our voice of the customer today and will help us break it all down to what this actually looks like for brands looking to engage patients in virtual care.
Thank you so much, Andrew. Thrilled to be here.
Psyched you're here with us. All right, let's get into it. Here's the number I think resets the entire conversation. 54% of patients, when given a choice between a virtual visit and an in-office visit, choose virtual. Not because they had to, because they wanted to. And 76% say virtual care makes care easier to access overall. That same 76% say it's easier to use than they expected, which tells me we've crossed some kind of adoption threshold where the friction has mostly disappeared. So I want to open this up to all three of you, and anyone feel free to jump in. What does the data tell you about where virtual care actually sits inside American healthcare today?
I think the interesting fact here, I believe, is that healthcare is catching up with the rest of the digital experience, right? Mm-hmm. It had been thought for many years that healthcare was lagging in the digital side of it for many reasons, right? Thought on patients of being in that space, et cetera, but it certainly has caught up now. And I think the fact now that patients are used to the Amazonation, so to speak, of digital experience on the web, the Googleization of experience on the web, using those keywords. So I think it just means that healthcare is caught up and that patients, consumers are much more familiar with that experience and are comfortable in that space.
It's truly mainstream, right? Like 100%. I think what we're seeing is that if over 50% of Americans actually prefer virtual, we're not talking about I have to use it or there's a drug I really want, but I can only get it online. What they're telling people is this is my preferred method when available. And so I think it's exciting to consider that what that means for healthcare and we're going to get into the data a little bit more.
We definitely are.
But if 76% are telling us that care is easier to access through virtual care, then what we're looking at finally is an opportunity to use digital technology and virtual care offerings to address care gaps, to address things that I think have concerned all of us for a long time around lack of awareness, all the way down to I think I know I have a condition, but I can't make it to my physician.
Right.
I'm not scheduling the appointment the way I need to. I got the script, but I don't understand it. I need to get to the pharmacy, but I kind of forgot because there's 40 things on my to-do list. It's exciting that what we'll talk more about, I think, today in terms of how we're defining virtual care means that there are tools in place that address all of that and speed time to adoption of life-saving medication.
Absolutely. And I think from the client perspective, it presents an opportunity. Mm-hmm. Unfortunately, an all too often overlooked or missed opportunity, but an opportunity nonetheless. And especially informed by what you both shared, I think it's a next environment for us to meet folks with those educational pieces so that they can advocate for themselves and, bring up brands or symptoms or care points that they might otherwise miss.
It speaks volumes about the patient, right?
Yes.
Ease, flexibility, all of that are becoming much more important for the patient. It had been for so many years that the HCP was the center of the healthcare environment, right? Now it's totally flipped.
Yeah.
Now the patient is the center. They're controlling most of the information flow that goes on. And it's revolutionizing, I think in a good way, how care is delivered throughout the country and throughout the world.
Yes, absolutely.
Ray, let me follow up on that because the report also found that 45% cited faster availability, 43% cited faster travel time or travel time saved. Those feel like access arguments, not convenience arguments. Is that distinction meaningful?
It's meaningful in the sense that, as I was saying before, the patient is now in control, and everybody needs to catch up to that. And I think the healthcare in general is still trying to catch up to the fact that the patient is now the center of access in all of that. But I think it's really important to understand that the patient wants what they want, when they want it, and how they want it. Right. And we have to catch up to that as an industry on the marketing side, on the care delivery side, et cetera. So I think it says more about the patient than it does about anything else. And we have to catch up to that.
That sounds right. All right, let's move on. I want to go a little bit deeper into the finding that I think is one of maybe the most important one that we kind of uncovered with the report. We looked at specific specialty areas and asked patients a simple question. Without a virtual option, what would you have done? 78% of neurology patients said they would have delayed care or skipped it entirely. 73% of OBGYN patients, 70% of cardiology patients. And across all specialties, 10% said they would not have sought treatment at all. That last number deserves to sit there for a second. 1 in 10 patients, no care, not delayed, none. Christine, what does that specialty data tell us about virtual care's role in keeping patients connected to care?
Well, I think one of the things that's really interesting about it first is that we're talking about chronic conditions. So when you dig into those specialty numbers, you're not talking about a vanity drug. You're not talking about a one-off need for a prescription that you sort of have decided you want and you're going to go get it. We're talking about a way that patients with long-term or complex health challenges are now getting care faster or that they wouldn't have gotten at all. I dug into this statistic as a part of the report. It's a combined number of 65% of patients in the general population said they would have delayed or skipped. And then you get deeper. What you're looking at is chronic conditions that require follow-ups and refills and condition management. We've all been in that position where you need care, right? Either you need it or you're caregiving for someone who does. What virtual care, this data is telling us, is that it is providing a very needed solution to the access or convenience challenges that were raised in the first point, but really just how do we help patients get faster and better at their healthcare journey? How are we helping them solve that problem? And virtual care is representing a really fantastic opportunity to do that.
Yeah, I also think it's uncovering a very systemic problem in the entire healthcare delivery ecosystem. Right? When you see something like that 10% of patients wouldn't have sought care at all, that's a big challenge. To quote a sports analogy, the best ability is availability, and if your doctor's not available, it just changes the entire way patients look at getting care. So I think it's very important that virtual care could kind of change that gap that's there and really kind of close it in the sense that now patients feel comfortable using it to have care delivered to them in one way, shape, or form. So I think it's very important for socioeconomic reasons as well as for individual patient reasons.
Yeah, I think leaning into that why a little bit more when we think about proximity to care or available resources or insights or information, it is often those follow-up visits or those auxiliary visits, those tertiary touch points that I think get left behind or get forgotten about. And often we're talking about adherence. How do we get folks to stay on brand? It's not just about converting them, but how do we get them to stay on brand? And this becomes the opportunity to have those reassurance touch points, those check-ins, and hey, if it's not working, it could be better. Let's think critically about what's happening, and let's equip and arm patients with those right questions to ask to have that informed discussion, and removing some of those barriers to access. Whether it is proximity or access to a specialist that is going to meet you where you are on your particular care journey. To your point about chronic conditions, I think it's really telling to some of the specialties that you listed often would be thought of as not those that you could attend to virtually. So that's an interesting eye-opener too.
Yeah, I think some of that is based on how we've expanded the definition of virtual care, because you're not just talking about telehealth. You're talking about what the references you made in terms of patient support programs and refill reminders. So I've been in the industry for a long time, and the very first conference I ever went to, the first presentation was on the adherence problem. And candidly, I don't think we've made a lot of ground in what is over 20 years at this point. Virtual care is exciting because it could potentially meaningfully address the adherence problem.
Absolutely. I think getting insight into someone's home, right, and seeing their environment so that you can ask.
Yeah.
I was at an ADCES conference a number of years ago, and they were talking about the access into someone's home, giving you that visibility to say, okay, well, why isn't treatment working? Let's see what's going on. Let's see the environment in which you live. And when we're giving you these treatment tips and we're giving you this advice, there could be a very practical reason why that's not working, why that's not yielding positive results. And so I think there's a whole other layer to this beyond the conversation, environmentally, whether it's offsetting discomfort or allowing somebody to have those notes that they might not feel comfortable bringing, that really moves that needle in a very positive way.
Yeah, and it's interesting, it's almost the inverse of what you'd expect around things like sensitive topics.
Yes.
This idea that patients might actually be more comfortable talking about something sensitive, sitting on their own couch, in their own home,
Great point.
in their pajamas, right? Getting to say, hey, actually, I'm really uncomfortable about this, or I haven't been adherent because of this, and I don't have that sort of white coat syndrome that you get when you're in an office. So,
And taking it a step further, thinking about care partners.
yes,
Right? There could be a caregiver who can't attend a doctor's appointment because of their own schedules or their own life.
Yeah.
And now you've opened the door for that person to be there as well, and keep someone honest about how much they're adhering to medication and are they taking it appropriately. And, well, you seem to be using that rescue inhaler far more often than you suggesting that you are. So.
Yeah.
I think adherence is kind of built around trust in a lot of ways, right?
Yeah.
And trust is built through authenticated actions, right? And that's how you build a trust.
Yeah.
To me, one of the least authentic things is when you try to call your doctor to make an appointment and the next available appointment is 8 months, especially for specialties,
that's
right?
Right.
So,
Yes.
what virtual care does, it bridges that gap.
Absolutely.
And now more touch points with your physician, with your HCP. So it gives you the opportunity to have those conversations, to have that your physician, your HCP say to you, I think you need, you get that refill, so it just drives that home in a very trusted environment.
Yeah, absolutely.
I'm so happy you brought up trust. Perfect runway to my next question.
That's what I do.
You're so good at this. So one of the things that we uncovered with the report was the trust picture. And it was something that when we were putting it together, and personally, I just wasn't fully prepared for. Some numbers. 88% of patients say they feel safe in virtual care. 86% say they're comfortable discussing personal or sensitive topics through a screen. 87% are satisfied with their last visit. And that 87% holds across genders and across generations, which matters because there's a common assumption that older patients are more hesitant. The data says that split doesn't exist anymore. So, Ray, what does that trust level that's approaching unanimity actually open up? Because I think the clinical conversation piece is where this gets really interesting for pharma.
Yeah, I think Christine made the point. Think about it for a second. When you're sitting in your own home, when you're sitting in a trusted environment of your own, right, you're going to be open to more things. So virtual care allows for that. So that conversation can get more deeper and more impactful that you have with the HCP. And if no matter what the setting is, I think if as long as we can induce that and have those more clinical conversations, they're going to lead to better outcomes. And better outcomes are good for everyone in that regard. So I think you hit it right on the head. It's somebody who's very comfortable. The comfort level is not just there. It's because you're in a trusted environment, you're in a trusted facility, whatever you want to call it. I think that's the starting factor in all of that. And it's one of the main points in all of that. And again, that opens up much deeper conversations that I think we all need to have in that regard.
Absolutely. And from a brand perspective, you're in a totally brand safe environment, in an opportunity to deliver that practice pearl, that insight, what have you, that's going to, again, shift somebody's perception to, is their own treatment working? Is the treatment that they're on something they should continue? Should they, pivot in their conversation with their provider in some way to, again, foster better dialogue? And I think, when we talk about the comfortability that exists on the patient side and also on the brand side, The other thing that does is eliminate some of that absence of recall, where you kind of put a halo
point.
effect around, well, what did the last week look like? If you have so much of a lag time between your provider appointments, you're not going to remember what the last 3, 6, 12 months looked like. You're going to go, yeah, last week was pretty good. So yeah, I'm doing okay. Thinking particularly about that migraine patient who's seeing a neurologist.
Right.
Depending upon where they are, if they're not someone who's dealing with chronic migraine or debilitating migraine, but they're still experiencing them, that frequency in self-reporting is going to be somewhat jaded. If you can cut back on the gap between those appointments, foster that trust,
100%.
now somebody's a bit more disarmed and may more correctly reflect on where they are with things.
Yeah, that's a really fascinating perspective, right? That virtual care gives you the recency opportunity to say, oh, okay, I didn't have to wait 8 months for the appointment, like you were saying before, Taylor, that I'm in this presence of mind where I can sort of accurately reflect on what's happening. I think the other thing that's really interesting about trust is something that you brought up earlier in terms of pharma's ability to engage. But this is exciting because often pharma struggles with trust. Right. We all know the numbers. But this is fascinating because it's a landscape where the trust already exists. I think that's so exciting for pharma because it's a place where we don't first have to convince people that this is a safe space or that this is trustworthy content. It also represents a significant burden of responsibility that I'm excited to see how pharma and their partners steward well, because it's an opportunity to add patient support programs, to add refill reminders or disease awareness content in an environment where patients are already saying, I feel safe here, I trust the content, I'm having a conversation with a trusted care provider. I'm going to assume that the other content that comes across the screen is valuable and relevant for me. I also want to see pharma make the most of that opportunity, but use it really well. Like, be very thoughtful about how we engage.
It's an interesting, Kelly made a really interesting point that just popped into my head as well too. And in that environment, that comfort and trust level actually makes you step back and say, maybe I need to challenge this what the doctor's saying, right? In a exam room, you might be a little intimidated, and you might not speak up the way you need to speak up.
Yeah.
But in a trusted environment such as your home or wherever that may be, you may have the opportunity to say, hey, wait a minute, what about this or what about that? And, obviously the goal of all pharma marketing is ask your doctor, right?
Yes.
And so you now have the
Yeah.
opportunity to kind of use that up to use that ability and that comfort level to actually do that.
Yeah.
Right.
It may not be the same in an office physical environment.
And from
It's
that-
essentially the foundation to the access to the speed.
Sure.
Right.
It's that triumvirate
trust
that
first.
kind of
Absolutely.
comes together. But
Yeah.
and fortunately or unfortunately, with the advent of virtual care, and then all of a sudden, hi, COVID, right?
Yeah.
That condition changed overnight, where all of a sudden everyone was virtual, everyone was video, and everyone got comfortable. The part that, as I said earlier, kind of surprised me a little bit was just the fact that you're literally sitting there and everything you're now working on a screen for as many months as we were, and now you have a doctor's appointment, you now do it through virtual means. It's not anything new, and here we
Right.
are, and it hasn't really let up.
Yeah.
So I mean, from where I sit, I'm like, it's a condition set or a condition level set when it comes to virtual care versus non-virtual care. The access point, speed to care, and trust is the backbone, sets the whole thing forward.
Yeah, the key is care is care,
Yeah.
right?
Right.
And I think that's people are getting more comfortable with the fact that care can be delivered virtually and in person.
Right.
And they're comfortable with either of those, right?
Right, and that sort of like filtered level situation, it doesn't really matter. The care is care. It's a really good point.
And Ray, it comes back partly to what you were saying before about the reality of patient demand now. And I think COVID was part of this. GLP-1s get some of this credit too, because it established a behavior for patients where you could advocate
Right.
to say, I would like this, I will use telehealth to get it. And so I think this environment has a little bit been created as a net positive where patients are empowered to say, I know how I need to care for myself. I would like to talk to my neurologist about my migraines more often. I also cannot come to the office this often. So I'm going to request a telehealth visit because that gets me closer to a standard of care that I'm desiring.
The interesting part about that is, empowerment.
Yeah.
it's the patients empowered themselves
Yes.
in that regard, right?
Yeah.
Usually there's another impetus there somewhere, and I think that's been lagging by pharma,
Yes.
the manufacturers. I think pharma needs to take a step forward and be part of that empowerment, instead of in some way, shape, or form maybe being against it and for whatever reason, becoming brand to brand. But I think it's a huge opportunity. And Taylor, I don't know if you feel the same way from a marketing perspective.
I do, though I would say that there's the elephant in the room of health literacy, right?
Sure.
And then
Yeah,
also
that's true.
regulatory and what we can say and what we can't say.
Absolutely.
There's
There we
that.
go.
You know,
The bad word.
We move on.
we'll pretend that it doesn't exist, but it
Yeah,
does.
it
And so,
does.
you know, where, you know, you might prefer the punchline at the front, right? You want
Right.
that hard-hitting call to action. This is what this can do for you. There are often a lot of layers of red tape and things that we cannot do
Yeah.
because of those safety regulations. And so when you're thinking about a creative and the message and how do we convey this and how do we do it in a way that's digestible and going to resonate with as many people as possible, but also feel tailored and meant for that person in that moment, it becomes an incredible challenge, and I'm very glad that I don't work at a creative agency because it almost feels Herculean as far as its task. But I would say to that end, I think we are doing a fantastic job of empowering a lot of patients to be more proactive in their care.
Yeah.
I think, though, you know, there are a lot of folks still left on the table. I think, you know, there is something to be said for giving someone all the right questions to ask, but them not understanding the answers they get in return.
Yeah.
I think, you know, what virtual care is doing based on the numbers alone is setting up a better opportunity for health literacy for someone to be in their own environment and speak in their own language and receive information at a time where, again, we are influencing a conversation.
Yeah.
Not necessarily the outcome, although we would like to do that. At a minimum, we would like patients to wind up with the best care for them and giving them the tools to start that conversation and be the catalyst to find that better treatment or stay on a better treatment and all of the things therein.
Social determinants of health is such the 800-pound gorilla in the room. It's amazing at all times.
Right. But Taylor, I think it goes back to your point. It's the trust is already there and the platform is already there. So what's exciting, I think, in this case for pharma is maybe pharma's role is to focus on the health literacy component. Like what can we as an industry contribute to that conversation and be really thoughtful about what those answers are, what kind of, you know, how can you address as many of those social determinants of health challenges and health literacy challenges as possible from either a branded or unbranded perspective. I think that's exciting. So hopefully that shows up.
Yeah, I think it is that parallel path from all of the successes we've seen over the last decades, 40, 50, 60 years, that point of care has been a thing, you know, in the physical office and fully coming to the understanding and realization of the power and impact of virtual care.
Yeah.
And to be clear, you know, none of this lives in a silo, right? The patient journey doesn't start and end in a physical world or in a virtual world. You know, there's a lot of interplay and overlap there and a lot of those levers that we can pull. And as a media planner, you know, I think in the years that I've spent spending other people's money, I can tell you it's best to diversify, right? It's best to be present and to show up at every single touch point in the care journey and making sure that you are fostering that dialogue, whether they're seeing various specialists or whether that, you know, consideration for treatment begins at a very early stage or later on. It's really a piece of the whole puzzle that fits together that is the healthcare journey and the treatment journey to better care.
That's a good call out because patients aren't just using virtual care. It's not like we have virtual care patients and point of care in-person patients. We're talking about them adding, this being an additive part of their journey. And for some of them, it's a preference, but what you're really looking at is that entire, and that's what we need pharma to do, right? And, you know, I think folks like you, Taylor, are really leading that discussion about how does this fit into the overall ecosystem of the patient journey? And do you know your patient's journey? And what does that look like? And where does virtual care fit in as a piece of that whole puzzle?
It highlights the point that we have to understand the patient and how the patient is moving through their journey, right? From the beginning through the end. And maybe sometimes there is no end, right? But it's so important to understand that. To your point, Taylor, those touch points may need different types of communication in each of those touch points. So the only way to understand that is to understand the patient and utilize the best opportunity at that stage. So it's so important, but it is such a big opportunity.
Yeah. Absolutely. I think the point of care environment is just that, right? We often get thought of as a channel, but we are truly an environment that has many, many levers to pull.
Oh, yeah.
Yep.
And, it's great to see this arising as another opportunity for us to lean in on.
Agreed.
Yeah, when we were thinking about the redefinition of virtual care, from the top of this, one of the things we thought about was it's truly an integrated play. The full communication spectrum happens from that first appointment and that virtual care appointment all the way through to all the different touch points, right? But it's not separate. It can be an integrated play with point of care. If it starts in office, it may end up virtual. If it starts virtual, it may end up back in office. So to see it as not just the virtual care ecosystem, which has its now place here, but also for both to be able to work collectively and together, that's also a benefit. It benefits the patient at the end of the day. It benefits care at the end of the day. So access, we've talked about speed to care, we've talked about trust, we've talked about, but now all the levers. So many ways to engage and so many different places to do it. Here's something the report surfaces that I think is genuinely new as a category insight. 51% of patients say they're focused on their device, and I mean the screen for their telehealth appointment in the period before and during a virtual care appointment. And 46% say they actively want to receive health information or educational content, which we've talked about, during that pre-visit window. That's a moment of attention that may be under-leveraged. The patient's already in the healthcare mindset. It's a captive audience, and nearly half of them are raising their hand. Taylor, from your perspective, what does that pre-visit window mean? And why is it different from other digital touchpoints pharma is already buying?
That's a great question. And I think it, harkens back to something we were just discussing around the parallel path between the in-office ecosystem and the virtual ecosystem. We've done a very good job as an industry of being ever present in the waiting rooms and in the exam rooms and in those exhale moments right before the provider comes in. And now we have an opportunity to be present in the virtual space in that same capacity. What's different in first comparing the physical in-office to the virtual space is that you have someone's undivided and captured attention, right? They are not looking away because they are actively waiting for their provider to join that
right.
meeting. So from a marketer perspective, it's probably one of the most valuable few minutes you can have. That I think is unrivaled as far as the value that exists in those pre-visit moments from an advertising perspective, right? From the most valuable impression you can have. I think where it becomes different from some of the other display-based or digital tactics that we're doing is those are a little less environmentally conscious or environmentally specific. I think what we're able to do in virtual care versus some of the other things that exist is really contextualize this in a way that is going to be meaningful for that health literacy of the patient, for that moment prior to discussion, right? Where they are waiting for their provider to come in and really let them know what's going on and share their experiences and how their medication's working. And, oh, hey, I heard about this thing. Do you think it'd be a good fit? Or, I think we may want to revisit this, or I'm experiencing this. I think, it really becomes this individualized, highly contextualized, unavoidable exhale moment that's just so invaluable for us.
When I was on the agency side, we used to have a little saying that attention means retention, right? So it used to be, how do we find those moments when the consumer has undivided attention in that regard? And so to that point, you have a one-to-one opportunity in this environment to have an engagement that could be more meaningful than probably anywhere else potentially in that regard. How do you use it? How do we, as a manufacturer, as an industry, how do we use it? I think it's important.
Exactly, and it's one-to-one-to-one, right? Because it's one-to-one, marketer to patient, and then immediately patient to provider. And cutting through all of the noise that exists when you're in that office setting or in a website, being able to just really focus that energy. You're absolutely right, and that remains true today. Attention absolutely yields retention.
Let's talk about younger patients. We found that with the report that they have the strongest appetite here. So how do you think about activating that specific window versus what you might do on social and search to engage that audience?
That's an excellent point. And I think it's not a versus, I think it's an additive situation because a lot of the younger folks are getting health information from social channels, from another trusted source, whether it's a familiar name, vetted or not, that's giving them health advice. I won't say health care, but health advice. and at least doing the job of leading them to have a conversation with their provider, which is the ultimate goal, right? I think the work that you all have done here in this report and continue to do to give us insights into those demos for who is using this and where, why, and how help us with brand planning, right? They help us understand where we can meet folks, where they're stepping into a more virtual setting for care versus staying in those traditional in-office placements. I think that it's all additive as opposed to taking away from.
Exactly. Yeah.
And I just want to say too, it's not just the younger generation that's doing
Right.
it. My mom is 86 and doesn't get out of the house very often, so she loves to talk to her doctor. She loves to talk to her doctor and yell at the doctor on virtual care as well as in person. So it's across multiple age groups, and it's even growing in the more aged group.
Well, and I think there's an imperative here to some extent. And you mentioned the fact that the younger generation, and let's be honest, the older generation with all the Facebooking, are getting a lot of health information, misinformation perhaps. If you're talking about an audience that's focused at least 50% in a white space environment before a digital visit, and 46% of them have already said, hey, I actually really would love some health content here, there's an imperative, I think, for the industry to figure out how to add something that's valuable and instructive in that moment, because we can't sit back and assume that they're getting it someplace else, candidly, because it's
a responsibility, right? That's a great way to look at it.
I do think that there is what we're seeing in the data and the report overall, I think represents a responsibility or mandate to engage in the virtual care space more than like, hey, this could be a fun place to maybe consider. It feels like the tipping point is there.
All right, let's look at the marketer side of the equation. With 81% of pharma marketers saying they increased virtual care investment in the past year, which is great, and that's a strong signal. But the question is whether that investment is really landing for brands. Taylor, I'm throwing this question right to you. I mean, what does that investment picture look like in practice? And is engagement the best KPI? And that's one we uncovered to be optimizing against. Or should pharma media and the planning around it use a different one?
That is a loaded question and a fantastic question.
You're welcome.
Thank you. I think, undeniably, there's a value represented here, right? And from a common sense standpoint, it makes the utmost sense to be ever present and to lean in hard. But we need proof of concept, and we need proof of value, and we need proof of conversion. So I think when we're thinking about what's the metric that's going to move the needle, impressions become not less valuable, but they're guaranteed, right? So that's a given. And you have a highly qualified audience because of the way that we're able to target, right? So you have folks that are receptive, you have folks that are attentive, you have folks that are the correct target, the correct demographic. So that almost becomes moot or a given, or just not to say it doesn't matter, but we've handled that from a targeting and upfront perspective. I think on the back end, when we're looking to see what was the value delivered, it really comes down to conversion to brand, right? Tracking that pull through. How effective was this? Because the goal is to drive conversation and to yield outcomes and to get those folks that should be on our brands, right? That's the ultimate goal. That's beyond conversation. It is, of course, conversion to brand. So I think in this space, in the same way that we would be critical of those exam room programs, I think we should really be leaning in here and thinking about conversion to brand. That said, I think that conversation starts when we're doing our planning. And it starts around, what are we trying to do? What are we looking at telehealth? When we think about that care journey and the function of telehealth in this particular patient journey, is it to drive awareness or is it to drive conversion? And based on that, you'll learn, which is the better lever to pull as far as measurement and proof of concept.
I think that's a great way to put it too. I remember when I was in media planning, we looked at each component of our media plan, and each component of the media plan had a specific function. Right. So in this case, what is virtual care in the media plan for in that regard? And I think another important thing to think about, and I think you're getting to that point, Taylor, is conversion to brand has to be looked at as a whole, right? Because conversion to brand, especially in the virtual care world, may happen down the line a little bit, right? It may not happen in one appointment. It may happen at a specialist level after the fact. So I think it's important to do that. But virtual care does that. but you have to look at it in a broader sense. And I think also you were saying too, the fact that in virtual care, because of the data flow back and forth, you know exactly why that patient is seeing the doctor. And because of that, there's almost zero media waste, right? Every dollar you're spending is directed toward your target audience. And that's so key nowadays when everything is about efficiency in your media buy, et cetera. So you're now able to drive the efficiency of your media buys up overall because of the quality of that audience you're hitting. And I think that'll all show out in whether it's a conversion study, whatever you're looking at doing, because quality obviously builds results. And I think that's important to look at as well. I think you're hitting it right on the head with that.
So I'm curious, one of the things the study showed is that engagement is a number one KPI for like 66% of pharma. I agree with you, right? On like, hey, this is the reality, this is the landscape. I think we're increasingly hearing industry conversation about wanting to, if not being able to, measure patient experience, patient engagement. Where do you think that fits here? Do you think there's a possibility that, to your point about brand planning, like there's a place here where engagement does become a key metric?
Absolutely. And I think some of that weighs very heavily on the creative aspect of things and those
That's
optimizations, right? Because what are you engaging with? You're engaging with the message that's presented. So it does absolutely inform the work that we're doing.
Right.
It doesn't necessarily inform the investment behind the placement, but it certainly tells us what message we should be putting there, right?
Okay.
What's resonating, what's moving the needle. And to what we were discussing earlier, that sort of data could be the thing that helps regulatory understand, maybe we flip it on its head, maybe the call to action comes first, maybe that one-liner can be enough, knowing that then we've prompted the pull through and somebody's going to visit brand.com. I think that's the other aspect of this, and also thinking contextually, right? Somebody's waiting for their provider, they're not going to click on an ad because they don't want to navigate away. So
this is an education play.
Right. What the value there is in, becomes that lagging metric. To your point, if they are engaging, they're likely engaging after they've spoken with their provider, which is a huge tell, right? Now, not only were they active, attentive, all of the things that we've talked about qualified, but now they're taking that step. And so I think, again, it comes back to what are we trying to do here? What is the role of this channel in the overarching media plan? And where are we connecting with patients in their care journey?
That's really good. I think that's the call out, right? That pharma marketers need to be really clear with what the goal is. When you're setting this up and when you're deciding to invest, you need to know what you want to use it for and what the goal is. And that really dictates your measurement and engagement.
Yeah. Talking about engagement, we've been talking a little bit about PSPs, but the fun part now is we now have some percentages and some data to back up that engagement moment where where pharma can actually engage directly with the patient support program. So with that being the case, here are a couple numbers for you. 73% of patients say they would find patient support program enrollment during or after a virtual visit extremely or very valuable. And 57% of marketers already believe PSPs pair best with virtual care. That's a rare moment of patient demand meeting marketer intent. Back to the engagement thing. So the question the report raises is whether execution is actually closing that loop. Ray, from your perspective, where does Populus see that alignment producing useful programs today? And where is execution still catching up to the demand?
I think it comes back to kind of what we were saying before, is that you really need to understand this is a patient saying they want more information, right? So you have to lay into that, use that opportunity. And I think pharma is still catching up to that. So there is a gap, I believe in that respect. But then it comes back to the responsibility part. And I think during our call, our pre-call, I think you even mentioned this, Taylor, is yes, there's that part where patient is saying they want something, but do they really know what they want? Do they really want to understand? We have to help them understand that. So there's layers to this, right? And how you have to do that. So it's not just, hey, here's the PSP, sign up for it. It's this is what it's for. This is how it's going to help you. All that. So there's layers that we have to look at in doing that. I think virtual care provides an opportunity to do that because of the one-to-one interaction, the ability to have that, the frequency of part of that as well. But we have to understand that it's not just here it is. This is what it's going to help you with. This is what it's for. The patient wants something, but we have to, lead the horse to water to drink, and so to speak, in that regard. I don't know if anybody feels the same way, but I think that's kind of key.
Context, right?
Absolutely. You can't put a value on being right next to, adjacent that conversation that's happening. I think one of the challenges that some brands may face is, do we have the support pieces to give them? And are they consumer friendly? Again,
That's
not
the
to
health
put the
literacy.
onus on,
Right.
on
Yeah.
creative, but a lot of this stuff, because of regulatory, becomes very complex and very undigestible. And so, it's great to have a link out to a text-heavy page or
Right.
text-heavy PDF, but if that's not helpful for that particular patient, then what are we doing? Or if we don't have any sort of CRM for them to opt into to receive information, that's another challenge. So there's a lot of missed opportunity, but the opportunity is there. And I think that's been kind of the theme of this conversation, is that there is a plethora of opportunity for us to start to take advantage of.
And one of the things you mentioned, Populus, our perspective on that too, is I think we also believe that has to happen on both sides of the equation, right? Has to happen on the patient side as well as the HCP side. And I think that's key to what we're trying to do in the future, is make sure that education is happening on both sides of the equation, so that there is a mutually beneficial discussion of what this is going to mean for you, Mr. Patient, Mrs. Patient.
Oh, and we'll be talking about that in part 2 with the HCP perspective in our next webinar. Get ready for that. All right. We keep talking about engagement. I'm just going to take it down the line just a little bit further. Here is even more evidence that there is a certain green light when it comes to fulfilling patients' thirst for targeted content before and after their virtual care appointment. All right, team. What do you think is the strongest signal for what pharma should actually be building next?
I mean, I think Taylor answered it a little bit with the last one, right? It's health relevant, understandable, executable content that fits into the patient's virtual care experience. Because I think you bring up a really good point when you said that it's not like you can ask them to click out of the virtual care window. And you're talking specifically about telehealth there, but you can't ask them to click out to go to a brand.com. Right? And so I think it is being really thoughtful. Ray, you brought this up before. Know your patient journey, right? So you need to know what's happening for your patient and know that the content that you're providing is meeting that particular one-to-one experience and conversation. But, if 73% are looking for PSP content, I'd start there.
Yep. Heard loud and clear. Meet them where they are with messages that will move.
Right? Yeah.
I think that pharma needs to realize that there are two sides of this, and don't keep your patient communication and your HCP communication so siloed. There has to be synergy between both of them, and that's going to be so important as we go as we move forward in the marketing aspect of things. But that's my biggest thing, I would believe, is you can't keep those in silos. There has to be synergy. There has to be the ability to utilize both for the maximum impact on both sides of the equation.
I think there's another word that we haven't said, and that's budget.
Yes, thank you.
We don't have the ability to create infinite creatives, and maybe that's on the horizon. But for right now, we do need to be broad in our message, broad enough that we're not leaving anybody out, but also specific. And also mindful of what someone's going to be able to understand when getting that message, right? We have to think about health literacy when we're talking to patients, and not just writing something at a 5th grade reading level, because thankfully a good majority of our country can read at a 5th grade level, but are they comprehending what they're reading?
Comprehension
Because
is different.
medical terminology and diagnoses and treatment and all of that becomes so much more complex and out of the normal vernacular for most folks. Save the 4 of us here in a large way.
I'll save the 3 of you.
Yeah, but I think budget becomes that thing that creates the silos, right?
That's
That
fair.
becomes that barrier to us
Very true.
collaborating.
Yeah.
And not saying that we don't strategize, across.
Right.
I think that unfortunately we're set up in a world where there are different teams doing different things with different objectives, trying to connect with those audiences in the best way possible. And sometimes we do get very short-sighted. I will gladly admit that. But I think, again, we are limited in some ways based on trying to cast as wide a net and as appropriate a net as possible, depending upon, the indication or the population we're trying to connect with, because it could be very small, it could be very large, it could be very diverse. We have to be mindful of those things when we're going out, whether in a virtual space or in a physical space.
So I also think that's a challenge to us on the media partner side,
Yes.
right? I think that's up to us to help you bridge those gaps and help you make your budget go longer, right? And I think so that's kind of what our challenge is on our side, is to find ways to do that through our products, through our product suites, through what we're trying to do with AI and things of that nature. So it's a two-way street.
Yeah.
Absolutely. And if I can be encouraging for a second, I will say that we have started to have more conversations around those synergistic touch points, right? And not thinking about, again, physical or virtual exam rooms, so to speak, as just purely a DTC touch point. Obviously, they have to be DTC minded if there's going to be patient eyeballs on it. But at the end of the day, it is something that's not absent influence or impact on provider behavior. And if it is to act as that prompt to have that dialogue, to have that conversion, to have whatever our desired outcome be, it really is encouraging that we have a lot more brands starting to think of those exam room or those meeting of the mind moments not so siloed.
Right.
All right, we're coming up on time, and I want to give each of you the floor. Based on what this patient data is telling us, what's the one thing that you double down on? Would you double down on a stat, an action, a change, a theme? Christine, I'll throw it to you.
So I think for me, it does go back to the delayed care. If 65% of the population would delay or skip care, and that number is higher for chronic conditions, this is a mandate. It's not optional. It's not, oh, this would be fun to pilot. I think the mandate is clear that this is where consumers are both seeking part of their healthcare journey and allowing us to address a really big problem. And so I think it's that, and then also just from an industry perspective, I think the key takeaway is looking at this from a what's your goals, what's your media plan, what's your patient journey. So it's not one size fits all, and that's great because we're talking about an entire ecosystem. So be very thoughtful about your own brand relevance, your own KPIs, and what your goals are.
Taylor, your thoughts.
I think if I've learned nothing else, opportunity is the buzzword, right? There is a tremendous amount of opportunity here. And so what that means for my fellow agency folks is there's a lot of opportunity for education, right? Educating clients and making them aware of these with data-backed points, because we all like to make informed decisions, especially when we're making investments. So I think, the opportunity piece is obviously there. I think the other piece to it is educating both clients and my counterparts on, hey, here's this space that we're not playing in. How can we maximize it? And then having those candid conversations with our creative agency folks and saying to them, okay, here's this unique environment. I know that we can recycle existing assets, but what can we do that speaks to this moment specifically? And how do we show up in a more punchy way?
Gotcha. Raymond.
Yeah, I basically agree with both. I think the key here is understand the patient, understand the journey. I think it has to start there, because all these signals are given to us by the patient, right? What they want to do, how they want to do it. If we don't understand that, then how can we give them the right message? How can we give them the right opportunity? How can we give them the right education? So we have to understand, let's take the time, let's take the effort to actually understand why patients are thinking and acting the way they're thinking. And I think that could certainly educate us as an industry to do what we need to do to go forward to make it more beneficial to everyone.
All right. Thank you all so much. Thanks for you out there for joining us and this conversation. I mean, this is the kind of specificity this data deserved, and boy, did you guys bring it today. So thank you so much. And thank you out there for joining this conversation. This has been Virtual Care in America, the Populus Report Part 1, the patient perspective. Remember, the platform may be virtual, but the outcomes, they're very real. I'm Andrew Schulman. Thanks for joining the conversation. The full report is now available for download. Thank you to Christine, Ray, and Taylor. And thank you all for being here. We'll see you for part 2 of the series next Thursday, June 25th at 12:30 p.m. Eastern, the HCP Perspective. We'll see you then.